Karnataka and Bengaluru battling a deadly second wave of COVID-19. And at the forefront of that battle, the doctors, the nurses, the health workers. We bring you the voices of young doctors from Bengaluru city. They are struggling to cope, physically, mentally and emotionally, but they are not giving up. The working hours and the working conditions can be brutal.
Okay guys, so I have a story. Just like the famous movie Baby's Day Out, this is a doctor's day out story in this COVID-19 situation. A typical day would include 6 to 8 hour shift of COVID duty where you have to wear a PPE kit. A PPE kit, as you all know, is not that comfortable. It drains out a lot of fluid from your body. In this summer, what happens is you will be drenched so much in your own sweat that within half an hour the entire PPE kit will stick to your body and you will feel dizzy like twice or thrice. It will be fully foggy so you can't see anything, and more often than not you will end up having a very bad headache because of the dehydration. And after all of these things, you find out that some of your best friend is positive and you have to cover up for him, so you do extra duties so that probably you will have some more in your bank, and someday if you get positive, he will do for you.
During the past 2 weeks, the city of Bangalore has seen record number of COVID cases, and I have worked for the past 1 week in a ward of 170 patients for whom just 2 doctors were available to take care of them. Doctor-patient ratio stooped to such a low level that it was almost impossible for us to take care of our own patients.
We are facing huge shortage of beds, huge shortage of oxygen, ventilators, ICU care, drugs needed for the COVID patients. Yet, are we facing shortage of doctors, shortage of medical professionals? Yes, we are, but we are not able to notice just because every health professional is working overtime, say for about 48 hours straight without any sleep to serve patients. First thing is physical exhaustion. Say for example, junior doctor or maybe senior doctor who are equally working in COVID wards about 6 to 8 hours straight in the PPE, that too in this hot summer, without food, without water, without using washrooms, running between wards for about seeing 80 to 100 patients. It's so physically exhausting. And to compensate is co-worker, co-doctor in a non-COVID ward, a doctor is serving about 2 days straight, that is 48 hours straight, without any sleep to serve the patient.
The second wave of COVID has brought a lot of challenges in our life. There is a heavy exposure of cases. The caseload is daunting. Almost every patient who walks into our OPD is either a positive patient or a carrier. We work for 14 to 16 hours in a day in the hospital, which leaves us absolutely no time for even our personal work or our families.
In addition to the physical strain, the emotional pressure is enormous. Watching patients die, dealing with distraught families.
As someone who's worked in the first wave of corona, I noticed that many patients were coming in with symptoms of COVID. This time it was more severe. Many patients had visible symptoms of breathlessness and most of them required ICU care. And on most days we will only have like 1 ICU bed that was vacant, and we'll have to choose between 30 sick patients and choose 1 patient to be shifted to the ICU, knowing very well that the other 29 patients will die in the 1 or 2 days that were about to come. I am almost sure that I have seen more deaths in this short span of time than any doctor who has doubled my experience. And there are various instances where doctors, us PG doctors, are manhandled by the patient's attenders because we were short of ICU beds. How can we be responsible for all these shortages that the government is supposed to arrange?
And the second thing is mental exhaustion, emotional exhaustion. It's very hard for a doctor. We are human beings first, then a doctor. For any human beings for that matter, it requires so much emotional strength to see a death. And to see a death on a daily basis It's so traumatizing. Even though with our maximum effort, with our full-fledged effort saving the patient, we are helpless. We are in fact more helpless than you are in not saving a patient. And it's so traumatizing for any doctor for that matter to see people crying, family members crying, and people dying on a daily basis.
We are seeing a lot of youngsters who are being affected. All of them, not just most of them, are requiring oxygen, and in fact a lot of oxygen. We are trying our level best to treat, help and support our patients, but we are not able to help all of them. We see families are getting distressed, seeing their loved ones suffer, and they get arrogant and many of the times very aggressive. This is putting added stress and anger and agony on the already stressed staffs, and I see most of them crying and in tears at the end of their shifts. Many of my colleagues have also fallen ill due to COVID and are on leave, adding more pressure onto us.
In spite of spending so much of time in the hospital, sometimes we're not able to meet the rising demand for our care and for the comfort of patients. The second wave has brought a mountain of challenges. It would not be wrong to say that the first wave was just a minuscule trailer in front of the second wave. We also are feeling very helpless due to the lack of resources. This daunting task is testing us, our physical limits, our emotional limits, and sometimes even professionally it is daunting us. I wish and pray that all of you and your families are safe.
With the best of will, with the best of skill, what can be done if the infrastructure cannot cope with a flood of cases?
Without adequate resources like NIV or HFNO or NRBM masks, we are not able to do much for the patients. We are also human beings. We cannot perform magic and save our patients. We need adequate resources to treat them. Without these resources, we are also just helpless, and we have to literally watch them gasp and die in front of our eyes. I just refuse to be responsible for the blood of these innocent human beings on my hands, because I am not responsible for it. I am not responsible for the shortage of remdesivir or NIV or ventilators in this government hospital.
We have nothing to do with lack of oxygen, lack of beds, lack of remdesivir. But still what will happen is in India, randomly, because a doctor is available and there are no rules, people can just come randomly hit a doctor or a healthcare worker for the government's fault and just get away with it. There are no strict rules, right?
At this point, we are seeing a huge rise in COVID cases everywhere throughout our nation. Similarly, we are facing huge shortage of beds, huge shortage of oxygen, ventilators, ICU care, drugs needed for the COVID patients. In spite of doing all this, there's so much blame, there's so much critics for every doctor is going around in this social media regarding the deaths of the patient and shortage of beds, shortage of oxygen, shortage of ventilators. Are we responsible for all these shortages? Do you think are we responsible? I think not. I think there is so much need to be done to improve the health system. We don't want your appreciation. We don't want your thalis. We don't want your moral. Just don't blame us.
Is the government doing all it can to help these medical heroes at their time of need?
It's not even a good situation if a doctor gets positive as well. In India, there are beds reserved for politicians. There are beds reserved for judges, VIPs, but not for doctors, not for healthcare workers, nurses, lab technicians who turn positive actually doing duty. So if you do duty and if you turn positive, you will just stay in the queue and you will just miserably wait like all others. And after all these things, if at all, unfortunately, some of you succumb to the disease, if a doctor dies due to the infection that he got because of this, there is no insurance coverage. Yeah, it was told, but people who were diagnosed positive and succumbed to the disease during the first wave, their families are not yet paid. Forget about our families getting covered.
All of us young doctors are working without any COVID risk allowance in Bangalore, and that is all only because of our own dedication towards this profession and humanity. And without adequate resources, even if hard work and dedication is there, nobody can save patients. With many renowned epidemiologists predicting third wave of corona also, if the government does not build adequate COVID care centers by then, I don't think even God will be able to save us by that time.
After a long working shift, many doctors are worried about the simple act of going home.
We take more risk than an army officer. An army officer will never bring a terrorist back to his home. But every day I go on the battlefield, I bring back that coronavirus back to my home. Not just to kill me, but also my loved ones, my parents, everyone. So, in such a traumatizing situation where I have no security at my workplace, and I have no residential facility near my workplace so that I don't have to, not bring the infection to my home, and probably even no recognition, we are still working. And it is these times that make us realize that yes, we will keep serving you selflessly, but we want some validation, some protection, someone to even think about us.
Any doctor working in a COVID ward is supposed to go to his family back after his COVID duty, or its residence or hostel after a COVID duty. Is it safe for his family members to be exposed? At what cost are we exposing our family members? We are not telling will not work. We are in fact happy to serve this pandemic, but we want our safety. We want our family's safety to serve this pandemic.
I find it very scary sometimes to go to my house after my shift thinking I would be the one who will be carrying the infection home to my elderly parents and young family. Shift is very busy that we hardly get time to eat or drink. We are all physically and mentally exhausted, and we are looking for help and support to help each other and our patients to get them better. It is time we stand together, support each other and find this pandemic together.
We have said it before, we can't say it enough. Thank you to our frontline workers. On our part, we must do what we can. Wear masks, socially distance, avoid crowds, get vaccinated. The voices of our health workers must be heard. With Govind Murthy, Maya Sharma in Bengaluru for NDTV.